presentation is hypermetropia. So, first of all, I would like to tell about classification of refractive error. What is emetropia? Emetropia is parallel incident rays come to focus on retina when accommodation is at rest. So, what is emetropia? Emetropia, parallel incident rays come to focus on the retina when accommodation is at rest. Emetropia. Emetropia in parallel incident rays are not focused on the retina when accommodation is at rest. What are the different type of refractive errors? Which is hypermetropia, myopia and astigmatism. So what is hypermetropia? Hypermetropia in which parallel rays come to focus behind the retina when accommodation is at rest. The common name for this refractive error is farsightedness. Patient cannot see near objects. Classification. There is two types of classification, physiological and pathological. Physiological could be due to normal etiological conditions, imperfect emetropinization, and hereditary factors. In pathological, prenatal maldevelopment of eye, corneal or lenticular changes due to orbital inflammation, and neurological or pharmacological based causes. So, what is the etiology? Basically, there can be two types of cause of hypermetropia: refractive or axial length. So in axial length, the axial length of eye is shorter than normal due to imperfect emetropization or in inophthalmos or microphthalmos. And in refractive power, the refractive power of eye is too weak. There could be increased index of refraction. There can be loss of accommodation. A patient can be pseudophakic or aphakic. So, what is the classification? Hypermetropia can be described into latent and manifest, and in manifest, it is further divided into facultative and absolute. So, what is latent hypermetropia? Latent hypermetropia can be overcome physiologically by the tone of ciliary muscles, and it can be revealed only after cycloplegia. What is manifest hypermetropia? In manifest hypermetropia, there are two types of further hypermetropia: facultative hypermetropia, which can be overcome by an effort of accommodation. In absolute hypermetropia, there is no usual pathology, but patient cannot overcome by an effort of accommodation, which means there is loss of accommodation. What is the prevalence? The mean refractive error is 2 diopters in newborns. The mean refractive error is 1 to 0.5 diopters in children at age 6. The mean refractive error is plano in children at age 10. And the mean refractive error is skewed toward myopia in children after age 10. And after 50 or 60, they again become hypermetropic. There is no gender bias. In general, there are no significant differences between male and females. Hypermetropia can be more common in females. What are the signs? Uh, myotic pupil. It enables accommodation and increased depth of focus. Esophoria, inward deviation of eyes. With accommodation, eyes tend to converge. Decrease visual acuity at distance and near, especially the latter. And there can be occasional diplopia or double vision. What are the symptoms? There can be asthenopia or ocular fatigue, frontal headaches, avoidance of visual tasks, especially at near, blurry vision at near, and intermittent blurring of vision. So, what are the clinical tests which can be performed? जी सर जी सर पता चला इसमें क्या बताया अभी का चलो तो तुम बताओ तुम इतने आहिस्ता बोलती हो घर में चलो ठीक है समझ आ रही है चलो मुफ्ते जीते वोट में चल कौन उनकी बात इधर ही खड़ा होगा उधर क्या है जी सर।
लाइट चेंजर नहीं लगा हुआ इसके साथ? लाइट चेंजर होती तो इसका लैपटॉप के साथ।
क्लिनिकल टेस्ट क्लिनिकल टेस्ट में हम विजुअल एकुटी कर सकते हैं, अकोमोडेशन टेस्ट कर सकते हैं, रेटिनोस्कोपी एंड सब्जेक्टिव रिफ्रैक्शन ऑन विच वी कैन check the hypermetropia. Management, hypermetropia can be managed. Management. Hypermetropia can be managed by converging lens, contact lens, and it can also be corrected by refractive surgery up to 4 diopters. What is the management?
डायलेट करने के लिए क्या क्या है?
Spectacles can be used in which converging lens can be used, single vision convex glasses, contact lens, soft contact lenses, rigid gas permeable contact lenses. In surgical management, there can be IOL implantation, photorefractive keratoplasty, and LASIK. Thank you.